allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
So we'll open the meeting with public comment on any subject not on the agenda. Is there any public comment? Yes, Bill?
I'm Bill Upthegrove, County resident, 54 Cub Drive, and I'm also Secretary Treasurer of Broadwater Health Systems. On September 18th, I attended a training session sponsored by Montana Hospital Association entitled The Economic Impact of Montana Hospitals. I'd like to publicly share some of the information from the MHA Fall Convention that applies to Broadwater County. The session confirmed that rural hospitals are one of the largest economic engines in the community. Translating some of the details that I learned, each job at the hospital translates into 1.8 other jobs in the state of Montana. Based on Broadwater Health Centers employing almost 100 people, that's about 180 jobs in the state of Montana. For every dollar of wages, there's about $2.30 of additional economic benefit. Based on last year's Broadwater Health Center wages, that's over $8 million in economic benefit to the state driven by the hospital. Beyond the economic benefit, our rural hospitals support at least 3 functions that otherwise are economically very difficult to sustain. The first one is the long-term care for Medicaid patients. In our community, many people call that a nursing home, but it's at the Broadwater Health Center long-term care. The second is the emergency room. Last year, Broadwater Health Center saw 969 visits, and the acuity for us is growing, meaning we're seeing more and more difficult patients from things like car accidents. The third is the ambulance service, and we know that it's getting more and more difficult to find EMTs, and so we have recently added 2 paramedics to our ambulance service. At a recent seminar I attended, put on by John Tester, it was noted that if you close a rural hospital, you might as well roll up Main Street. I just wanted to thank our commissioners and our community for their continued support of Broadwater Health System. Having a hospital in our community is critical to our well-being. Thank you.
Any other public comment? So then we'll move on to approval of the minutes for September 16th, 2019.
I'll move to approve as submitted, Mr. Chairman.
I'll second. Motion been made and second to approve minutes of September 16, 2019. All in favor? Aye. Opposed, same. Approved claims in the total of $95,760.36.
I would agree for the claims in the amount of $95,760.36.
And I'll second the motion to pay the approved claims in said amount.
Motion been made and seconded to approve claims in said amount. All in favor?
Aye.
Opposed, same. Motion carries.
Thank you.
Approved claims in the amount of $47,551.76.
We'll move to pay the approved claims in the amount of $47,551.76.
Motion's been made and seconded to approve claims in said amount. All in favor?
Aye.
Opposed, same. Motion carries. The Extension Services Agreement between Montana State University Extension and Broadwater County of Montana. Is there a motion to approve?
I'll make a motion to approve the extension services agreement.
I second the motion.
Motion's been made and seconded to approve the Extension Service Agreement between Montana State University Extension, Broadwater County. All in favor?
Aye.
Opposed, same. Motion carries.
Mr. Chairman,
Yes, sir.
do you have a figure on the latest on extension service contracts as far as what they contribute towards versus what the county pays?
The total personnel cost is $59,952.56, so they pay half of that, right?
60-40 split.
60-40 split.
Thank you, sir.
We have a, from Bill Berkland, Pesha Associates. Here's last year's airport CIP updated with new dates. All projects and finances are the same as the last several years. The FAA is requesting these by October 15th. Please review, scan, and return to me as I will submit on your behalf. If you'd like any changes, please, do we need to approve this today?
Yeah, there's a block on the third page. If you like, you get all. I think this is the one. No, this is.
Oh, okay.
And that's for runway resurfacing, and then they're going to expand, I think in 2022, going to expand the taxiways and some stuff, so what that CIP is for.
Is there a motion to approve this?
I would make a motion that we approve the airport CIP.
It's a great program. I will second the motion.
Motion's been made, second to approve, sign the CIP airport plans. Any further discussion? All in favor?
Aye.
Opposed, same. Motion carries. Have a delivering assistance application, grant application for public safety fire, public safety law enforcement, public safety emergency services project for the Wheatland area. Is there a motion?
Can I see that, please? I haven't seen it.
I move we proceed with the grant. One, the services are direly needed, and two, it's a financially sound grant and proposal. You know, it's been a subject of multiple meetings and conversations.
I'll second that motion.
Motion's been made and second to approve the delivering local assistance grant applications. Any further discussion? All in favor?
Aye.
Opposed, same. Motion carries.
Question on the amount on that grant?
What's that?
Question is the amount on the grant?
$750,000 is the grant applied, and $250,000 from the finalizing of the TED. See, we have several magazines here, Government Solutions, Black Mountain, Public View Help is here for the website for the public to look at the county budget. We did talk to Black Mountain at the Mako conference about possibly going through that process to open our budget up some more so people can have a better look at it. Aircraft Maintenance Technology, Stormwater Solution. Let's see, what do you want? This is a letter from the Department of Environmental Quality Water Protection Bureau. Public notice for construction of a dewatering general permit, construction dewatering Arkansas State surface water. Department of Environmental Quality, East Gallatin Commercial Center Property Owners Association, north of Belgrade, Class 1 groundwater. Results from the Department of Health and Human Services Environmental Laboratory for the Silos Recreation Area. A letter from Virgil Binkley. A term on the trust board will end at the first of the year. I'm willing to volunteer for another term on the trust board. The past years have been very fruitful in working with the commissions on various grants, projects in Broadwater County. The current contract studies for the fairground, the Silos campground area are milestones in the planning, and and tooling into the future of recreation in Broadwater County. I'm proud to have been a part of the team that has worked with the commission to achieve the milestone goals. I will also be proud to be a member of the board to achieve future construction goals on the two projects, Virgil Binkley. So we will close the commissioners meeting and open a public hearing to adopt a resolution for fiscal year 19 budget amendments. Debbie?
On file on the desk, since you guys have a copy. Any questions with them? Any of the amendments that we had to do? Any questions on them? They're just year-end cleaning where people spent out of a line item that they didn't have budgeted before, and taking that into account with additional revenues that the funds and different things were received, how we came up with our totals.
Any other comments on the public comments? Yes.
Just a question, is there going to be any line discussion on any of the items at all, or is it just a package deal being presented as far as the amendment?
This is pretty much cleanup, because most of the items people have already spent, so their budgets and things were already based off of numbers they'd already spent.
Okay.
I I don't have anything to say unless somebody has questions. And some of them had no net change, I might point that out,
Okay.
but they're listed.
So we will close the public hearing and go back to the commissioner meeting, a decision to adopt a resolution for the fiscal year 19 budget amendments.
I have no comment. This is pretty much boilerplate. It goes with the budget. I move that we adopt the resolution approving the fiscal year 19 budget amendments as they have been provided the last couple of weeks.
Is there a second?
And then second motion.
Motion been made and seconded to adopt the resolution for fiscal year 19 budget amendments. Any further comment?
Here
All
comes the
in favor?
resolution with signatures.
All in favor?
Aye.
Opposed, same. Motion carries.
Thank you.
Go back to some mail here. Life Flight Network membership program discount. HIP compliance 2020. A receipt from United States Treasurer Bill Flyner restitution in the amount of $839.09. Memorandum of understandings with the Predatory Control Wool Growers Association and the Stock Growers Association. Broadwater County Health Alert, once again, health officials confirm first Montana case of severe pulmonary disease associated with vaping. And we have a claim here for burnt images photography for facilities photography. County expenses request there. Do you know why there's this note's on here?
Yeah, and I didn't bring my claims process. I don't know if either of you did. I know you both have it, but I'd like to discuss this with that policy so
Okay.
that we're all reading off the same sheet of music. So if we could discuss this on Wednesday.
Okay.
All right, thanks.
So we got a couple of minutes. I guess we can go to Commissioner's update. The Commissioners attended the MACO conference in Billings, or in Great Falls last week. Had a lot of useful information. I sat in on the Energy Commission meeting. Coal Strip 1 and 2 are shutting down January 5th, I believe. That's going to be about a $25 million hit to the state budget. They had numbers for the counties, but they didn't have those finalized yet. People who are pushing for the shutdown of those plants, I don't know that they realize this, when the switch gets turned on and those plants are gone and we have an event like we had March 4th through March 8th, somebody's not gonna have power. Those 4 days, Northwest Energy spent $8.1 million on market power that they had to buy. They had budgeted $3 million for the year. So not only are we not gonna have power in some instances, we're not gonna have a large amount of money coming into the state. When that happens, most likely our legislature's gonna go after entitlements. That's gonna hit all of our programs we have in the county. Those other 2 plants are set to close down in 24, 25, or 25, 26. And the issue that we have with that is that those days when they had to buy all that power was absolutely zero sustainable energy. No solar energy, no wind energy was available whatsoever. That's why they had to go out and buy that power. So when those plants get shut down, the other issue that we have is our transmission lines will only return 10% of what we used to send out. Because the way the lines are built, it's one-way traffic. You don't get back what you send out on the lines because they aren't built that way. So when those plants get shut down, including 1 and 2 when they happen this year, we're looking, Northwest Energy's power bills, I'm assuming, are gonna go up, and they're gonna go up considerably. I don't know if Montana's looking at blackouts. Somebody's gonna look at blackouts because we're just not gonna have enough power. And the most efficient power system that they have is nuclear energy, and I don't know how you're ever gonna get that permitted in Montana or probably anywhere. But all these people that have, everything is gonna be wind and solar, they can't keep up. And you can't store enough battery energy. I believe they said that they could store energy for 4 days. That's all they would have in their backup system. So when that happens, we're gonna, unless somebody comes up with something, look for budget hits big time, and look for your power bill to go up largely. So unless something happens with that system, I don't know what's gonna happen. Hopefully I won't be in office anymore when that happens. Buy yourself a generator. And that was the main committee that I attended. There was a lot of other good information. Myself and Darrell went to a public lands roads access deal. Everybody has the same, every county in the state has the same access problems that we have, the same road problems. It's becoming a huge issue with people and with landowners, people trying to fence people out. Sheriff's departments are getting called out left and right. It's not a budget issue that we can cover, but it's going to continue to rear up until we do something with it. And that's pretty much all I have.
I think along with that comment is what we learned too is to be sure that as a commission that we get our policies, our correct policies in place to help mitigate some of these things that we keep revisiting. I think what we see is when policies were put in place years ago, not that they were bad policies, but they were the right policy at the time. But now times have changed, and so do our policies need to change as well. So I hope that folks understand that when we start changing some of our subdivision regulations and things like that, that's the reason why. Yeah, I also enjoyed the Maple Conference, learned a lot of great things. I attended the LEPC meeting on Thursday, and then also the Fairgrounds Master Plan meeting on Friday night. One thing that did come out of the Maple Conference is, and I included some of that information up here, is how important the census is to our community. A lot of our funding, government funding, is based on this census. So we're going to start priming the pump, and the census folks will be here in the coming months to help us get organized, and hopefully we'll have a good census count. So feel free to take some of that information. The other cards here are the cards for the silos, or not the silos, for the Fairgrounds Master Plan. If you have input that you would like to have contributed, go ahead and fill out one of those cards. And I think you can go online and do that as well. The one thing that I think did come out of the census thing is that they're going to have a program in place where you can do it online, which I think will make it a lot easier for a lot of folks. And then the folks that don't do it online, and someone will come knock on your door.
One thing with the census, it comes from the very beginning of the founding of our country. And if we don't count everyone in Montana, it will not save the federal government money. It's not going to help the deficit. That money will simply go to another state that did count all their folks. So making sure we count all Montanans is incredibly important, and really just helps everybody in the state.
I think also I forgot to mention too is that if we have a correct census count, it may change the number of folks we send to Washington DC as well. So we may pick up an extra seat back there. So a lot of important things about the census.
And Mike, since we're at 10:30, I'd like to wait on my update until
Okay.
after, or when there's a hole.
So at 10:30, we have St. Pete's Hospital, Wade Johnson, Administrator, Townsend Clinic discussion.
Good morning. Where would you like us? Do you want us to sit up here, stand there? What works best for
Stand
you?
there, if you would, please.
All right, we can do that. So, I'm Wade Johnson, CEO of St. Pete's. This is Kendra Lenhart.
Yep, Kendra Lenhart.
And she's overseeing the development of the clinic here in town. We just thought we'd take a few minutes and kind of give you an update of where we are with the progress of the clinic, and then just answer any questions that you might have. I've been out for a bit recently and hope to get in front of you a little bit sooner than this, but fortunately we were able to get on your calendar and just spend a few minutes with you answering any questions that you might have, etc. So with that, I'll let Kendra just kind of give you an update of where we are with the development of the clinic that we have and its planning.
Sure. Right now, we're in the stages of finalizing our plans for a temporary modular clinic, medical modular clinic that will sit on that space while the permanent structure is being built. Also in the process of developing what that permanent structure will look like. The medical modular clinic will be about 3,000 square feet, and we'll have room for about 3 exam rooms for primary care walk-ins, and then we'll have 3 exam rooms for our traveling specialists that will be rotating through Townsend. We have a X-ray and a lab as well in that structure, and we'll also have at some point a modular CT that will eventually end up in the permanent structure as well.
We should have a sign probably going up, I think, this week, just kind of the future site of, if you will. We've had some conversations within the community, meeting with the school district and a few others, and we'll continue to do that as we move forward and let folks know where we are, what's going on. Kind of an interesting tidbits for you. And actually this surprised me quite a bit. In the last 4 years, folks from Townsend, Broadwater County, have driven 3 million miles to Helena, to St. Pete's, for appointments at St. Peter's. Really interesting to look at some of the analytic capabilities, one, that we have now, and then two, just to understand the amount of patients that we have within the community who have been seeking services and who have been driving in all sorts of conditions to be able to come and get care at St. Peter's. So we're excited about the opportunity to create an access point closer to home for them, for all of you here. And as Kendra was mentioning, to be able to have the specialists that will be able to be here and be in town, whether it's orthopedics, urology, there's a list, general surgery, there's a list of them, of our surgeons who have had patients for many years from Townsend who are looking forward to being able to see patients here locally as well. So being able to extend that, and then additionally those capabilities through telemedicine that we'll be able to offer. Once again, continuing to push throughout our region, getting close care closer to home for all of our folks. So that's kind of where we are. I think our still planning to get started on the permanent structure this spring time. And whether you know, after this weekend, I'm not sure what to expect for the weather as it relates to how that will progress over time. But it shouldn't exceed more than a year's time, I don't think, from a construction standpoint. It would be a beautiful facility here in town. There have been some questions that we have gotten. We had a forum here a few weeks ago. Interestingly enough, we actually have quite a few. We already have, I think it's somewhere around 60 or so employees who live in Townsend who work at St. Pete's. I don't know the exact number of Broadwater County residents that work at the existing facility here in town, but it's a pretty good number that are working for St. Pete's, and we anticipate that number will increase as we open our clinic here and hire nursing and MAs and support staff and other folks to work within our clinic. So we think that we'll be a fairly significant employer for Broadwater County, for Townsend in particular, I'm sure as well. And that's exactly how we want to see it continue to develop, is being able to have the local folks. And we have a very, I'll put it this way, we have a highly competitive compensation that we offer our employees. We have very attractive benefits, retirement, etc., for employees, and all of those elements of our compensation plan will continue to benefit the citizens here in Broadwater County. So we're excited about being able to extend that to folks here as well. We've had some folks who currently work for St. Pete say, hey, you know, will you have this role down there? Because I'd love to work close to home if I can do that, and continue to work for St. Pete's, but be able to do that. So some of our folks who might be commuting today may come down here and whatnot. So we think it makes great sense. We have staff, if you think about it from a lab and X-ray imaging standpoint, from nursing, billing, medical assistance, all of that, just really a rock throw down the road. So being able to cover staffing and maintain continuity, I think one of the challenges that has been faced here in town is just really the amount of turnover in staffing. St. Pete's performs way better than the national average when it comes to turnover, and we look forward to being able to have consistent staff for the community here, not only in terms of nursing and technicians, but also in all the various licensed professionals, the physicians and others that will establish long-term relationships here and not have to worry about revolving door type things for the community. The other nice thing will be the connection from a technology standpoint. So patients that are seen here, all their information, they show up in our emergency room up at St. Peter's. They have to be transferred up there, or they go to see a specialist up there, maybe for whatever it might be. All that information is right there available for their care, and that will help them in that transition of moving from provider to provider. One of the challenges that we have in our industry, sadly, is that when you go amongst organizations, you end up filling out the same form 15 times and still not always getting all the information you want where it needs to be. So being able to have that technology will be, I think, a real significant help to patients here.
And I think one of the things in the permanent structure, we're still identifying exactly what is going to end up in the permanent structure. But right now we have a primary care clinic, an urgent care clinic, room also for a traveling specialist, X-ray, CT, and then also physical therapy are what initially we're looking at having in that facility. As well as lab. Yeah. And the great thing about in our temporary clinic, we'll be having a runner 2 and I think up to 3 times a day, which will be bringing lab blood work back and forth from Townsend to Helena. So it'll be real time as far as results go, which will be great. And we have a lot of patients that come into Helena right now just for lab work. So it'll be really nice for them to be able to go to the clinic, have their labs done, and then those results will be sent right away to their primary care physicians or specialists in Helena that have requested the blood work.
I think the One thing I might mention too, and then we'll just turn it over to you for any questions that you might have. I think one of the questions that I hear frequently, or comments I hear, is the concern around long-term care. And what happens in Townsend if something happens to the local hospital. And I just wanted to let you know that long-term care and it being provisioned through a hospital, currently that's the methodology that's being used here in town. But that's not the only methodology. As a matter of fact, there's lots of small communities that don't take that approach. They have separate facilities that are long-term care facilities, provide what we call post-acute care, and they don't do that through a hospital. And so just to let you know, as we do our strategic planning at St. Peter's, we're having lots of conversations about what we call post-acute care. And that's that skilled nursing or the long-term care that people have need of. In Helena, one of the biggest challenges we have is placement. So we have patients who are ready to go home. Well, technically I should say they're ready to leave the hospital, not quite ready to go home, and they need to be placed somewhere for care. And we have a shortage of beds in Helena for that, to meet that need. That's one of the reasons over the preceding months we had done a lot of work to support the hospital here and worked with our hospitalists and with our case managers to help get patients transferred out of St. Pete's and down here, which I think financially was a help to the hospital here. But we are in discussions now as an institution about what we are going to be doing going forward for post-acute care, because there is a demand for it. The demand will continue to increase, and the supply is not where it needs to be yet. So I share that with you just in context of if you hear things like, oh, if the hospital goes away, then long-term care in Townsend goes away. That's not a true statement. It may go away in that capacity and how it's being delivered currently, but that is not something that's not the only mechanism by which you can deliver long-term care and do it very well. By the way, there are lots of small communities that take a different approach. So just so you know, I just want to make sure that you are aware of that, and we're very sensitive to that element of care, and recognize that that's a very important part of the continuum of care being provided to patients. So just something that I share with you. So with that, I just wanted to kind of open it up and answer any questions that you may have, address any issues or concerns that you might have while we're here, and if not, we hope in the future to continue to have conversations and dialogue with you as well. So if something strikes you, doesn't strike you this morning to ask, or that you're curious about and it does, you're more than welcome to call, or we're happy to continue the dialogue in future meetings as well.
When are you thinking that you'll be, your temporary facility open?
Probably January-ish time, sometime in the first quarter. So depending on a few different things, we should, I think we're still slated to have the delivery of the units here in December. So it'll just be a matter of getting things dressed up, and there'll be some things that we'll be doing on the facade and whatnot to get that ready. So yeah, sometime the first quarter, but probably January, February time would be our best guess at the moment.
And are your plans for your providers to live here, to
Yes.
travel, or?
So our specialists will travel. So we'll say, pick on urology or something like that. So they'll be coming down at whatever interval the demand to meet the demand here. At a primary care level, however, those providers will be here in town. We are actually recruiting. We've had conversations with physicians already who are interested in living in Townsend and being part of the community. Many of which grew up in communities like this or are from Montana and really want to be able to serve in a community and like this. See their patients at the store and Town Pump and Annex and everywhere else in town.
So will you be transferring patients only to St. Pete's, or will you go wherever the patient requests? requests to go.
Go wherever the patient requests to go. And maybe I could clarify that for you too, as relatives, as it relates to St. Peter's, even internally. So our physicians who work for St. Peter's, they can transfer patients anywhere they feel that the patient needs to go or that patient might want to go. That relationship between a provider and their patient, I think, is kind of a sacred relationship. And they may have family in one community but not family in another community, and they need to go where they will be best served. And that decision rests solely between the provider, the physician, and the patient. And we don't get in the middle of those. Now, I will say that in cases the patients would be required to be, from an emergency standpoint, because of EMTALA, and those are laws that govern the movement of patients, right, from an emergency standpoint. In those cases, a patient might have to be sent to St. Pete's just based on that. But for specialist care, for hospitalizations, surgeries, those types of things, that's up to the patient to choose. If they wanted to go down to Bozeman, then our providers would work to get them taken care of down in Bozeman as well.
Do you have plans for an ambulance service, or what are those plans?
So currently, we're in those conversations right now about what we're going to do for emergent services. We need to have more conversations here with the county and whatnot. We do plan to have some form of emergent service or transportation from our facility up to St. Peter's. And so haven't worked out the exact details of that just quite yet.
So from an emergency room standpoint, your clinic's probably not equipped for that right now?
That's something that we're actually looking at. So we haven't, the initial temporary clinic will not be set up as an emergency department. The new facility, and whether that contains one, we're still in the evaluation process for that. We're, in addition to looking at the providers that we have from a family practice standpoint, from an urgent care standpoint, also having conversations with our partners around the emergency care and having emergency physicians and how that connection can work with our urgent care. We do that right now in Helena, and so just kind of sorting through what that might look like down here.
Where do you see your relationship between St. Peter's and our county health department?
Hopefully good. As we continue to plan and work together, I think we've made a concerted effort, particularly over the last couple of years, to reach out and collaborate much more effectively with our local partners in care. And so we even now have we call it an Office of Population Health, but it's a kind of division of our organization that's really developing these relationships and understanding that while we can't be all things to all people, and quite frankly shouldn't be all things to all people, we can be a facilitator and a collaborator and a supporter of the local community programs, including the county programs for improving health. Mental health is a great example right now. We have ongoing meetings with at least 5 different agencies talking about our approach going forward with mental health and how we can improve that in our region.
How do you foresee your relationship with the local hospital and Billings Clinics in St. Pete's working out?
Yeah, so we have Billings Clinic's a great organization. I think we have a good working relationship with them. We have providers that have moved between our organizations historically, and we anticipate to continue those conversations and that work and collaboration.
You talked about earlier about the post-acute or the skilled nursing. I mean, I guess maybe give me an idea of how that would work. Different options than what we currently have right now.
Yeah, so as an example, my point in that is that you have nonprofit and for-profit organizations that run nursing homes or post-acute care facilities. So you have both segments of the industry provide those services. And they are in small communities. I came from a small community where that was run, rather than a hospital running the post-acute long-term care, it was actually an organization who all they do, eat, sleep, drink every day, all day, is run long-term care facilities. And my only comment is that is an option for this community going forward. I think long-term care needs to be in this community. I think it needs stability in that. And so I think there's opportunities for that. So if something were to happen to the hospital here, I just don't want folks to think, oh no, then all the care goes away, and then grandma now is 40 miles up the road. It doesn't have to be that way at all. And we would be happy to facilitate and help make connections to make that a transition if it were ever needed in the future. We would not leave Townsend hanging, if you will, relative to long-term care. I might mention while you're noodling a little bit too, that we are organizing our regional services board right now. So within our structure at St. Peter's, we have a couple of different boards, one of which is a regional services board that oversees relationships that we have throughout the region. And we will be having some local community members participating on that, and are also looking at developing a local advisory council that will provide feedback and information for us as we continue to move forward as well. So just, more folks involved in the community, engaged in the community, where we can get their perspective and get their feedback. And then, as I mentioned also now, and I think it'll be about, it should be within the next 2 weeks, you'll see a release about our regional services board, and I think you'll recognize at least one name on that board that will be serving here from Townsend. So we're also incorporating some of the Townsend folks into our governing processes for our organization.
Do you have any local people on your actual board? Do you have any Townsend or Broadwater County people on your board right now?
We do not right now. We will within a few weeks.
Does anyone else have anything? Bill?
Mr. Johnson, I'll move up here a second.
Oh yeah, like around the post there.
Just a couple questions.
Yeah.
Coordinating with the existing local hospital. You talked about coordination or collaboration. Local hospital is obviously important to this community. Why don't you propose using the lab, X-ray, and CT of the hospital as opposed to taking that business away from the hospital?
Yeah, so what I would say is that we don't currently view that as taking the business away from the hospital, because the patients that we currently provide those services for that are already coming up to St. Pete's using our lab and using our imaging. So I think that's one of the challenges. If you look back over the last number of years as the hospital has struggled here, and even quite frankly preceding to that, if you look at the data that we have internally, we've had patients coming to St. Pete's and choosing to do so for many, many years and using our services. And that's why we feel like the decisions that the hospital here is taking and partnering with another health system in that regard are independent of where our focus is and what we're doing. We're extending our services locally for our patients that we have had for many, many years.
But don't you think it would help the local community by sending those people there?
I think the community members, if once again, they have the opportunity to choose to do so. So if they want those services through the local facility, they're welcome to get those through the local facility, and that's a matter of patient choice.
Second thing, I'd like to ask a little bit more about post-acute care. In my kind of the limited knowledge I have, it kind of falls in two categories in swing beds in the local hospital. One is like a rehab patient. What do you think about the local hospital's quality as far as swing beds for a rehab type patient?
Yeah, so I'm not a clinician, so I can't get into specifics of the clinical quality that's provided and provide any specific evaluation of that. I will tell you that, to my knowledge, we've had good experiences with that.
As we talk about keeping people close to home, so I would hope that would be a collaborative agreement we could have, that people, especially from around here, could be sent back to the local hospital. The second part is...
It's actually, just so you know, just so the commissioners understand, so it's actually advantageous for us to transfer patients out of the facility. One is, who wants to hang out in the hospital any longer than they have to? That's one thing. So it benefits the patients. But secondarily, there are economic incentives. The Medicare has designed it in such a way that we get paid differently up at St. Pete's than you get paid here locally. And so for those patients maybe that have a surgery, an inpatient surgery, we get paid a set amount for that surgery. And after some period of time, as determined by the feds, the patients should be able to go home. Sometimes they are and sometimes they aren't. Just we're all different and unique. But after what's considered the length of stay for that particular type of condition, we can transfer that patient to a critical access hospital, as an example, and there's other facilities as well. And it's called, they call those swing patients or swing days. And that is a patient who's not quite ready to go home, but so they still need a little bit of nursing care, but not a whole lot. And so that transition can be a few days, can be several weeks, just kind of depends on a number of factors. But anyway, so what you saw the preceding months, as an example, is us working very hard at St. Pete's to be able to transfer the Townsend patients back to Townsend at that appropriate time. And so what it did is it was a benefit to St. Peter's, and it's also a benefit to the local hospital here.
So
because while we don't continue to get paid for that service, the local hospital does. So a lot of medical centers have worked to transfer those patients to local communities.
So as far as you know, there's no quality issues standing in the way of that now?
Not to my knowledge.
Okay. The second half of the post-acute care, if it's not a hospital long-term care swing bed, I think that has to be a nursing home bed. Is that correct for current law?
Yeah, so I can't speak to the current laws as it relates to long-term care. I leave that to the long-term care experts, so I can't really answer that question.
So you've indicated that there'd be an alternative of someone else to come to this community that could open that. Is St. Peter's thinking about that at this time?
We don't have any current plans around long-term care. We're right now in the beginning phases of developing what I would call a post-acute strategy. And so we don't have that set in stone today. No, we don't. So I think over the next year or a couple of years, we'll have a better feel for that.
So currently in the state, when's the last time they've opened a nursing home in the state?
I don't have an answer for you.
It's a difficult process.
Yeah.
Okay, just wanted to know that it's not as easy as if something happened, we can just get more post-acute care overnight here.
Yeah, and I don't think, in today's world, regardless of what it is in healthcare, whether it's acute or post-acute, so hospital or post-hospital, it takes planning and it takes time. There's nothing that's done overnight. It's just our business is too complicated and fraught with too much regulation to be able to do things overnight.
Well, I would just encourage you to collaborate with the hospital here because it's important to us. Thank you.
You bet.
I have a question.
Yes, ma'am.
My name is Nancy Marks.
Yes, Nancy.
How would you handle the payment of ambulance service? I think currently the county pays part of the ambulance service, is that correct?
We buy the ambulance, yes.
Okay. So would you expect the county, would you expect the taxpayers to help you if you start an ambulance service that is in competition to the one we have?
No. Yeah, we have to, I think there's a lot more conversations to be had around the emergent care. Obviously, we have a very large ambulance service that covers the region and collaborates on a lot of different levels. And so I think first and foremost, we want to have more conversations about understanding the specific needs here, and if there's some way that we could help enhance those in some way. And if not, then that's fine too. So.
Do you have your own ambulance service in Lewis and Clark County, or are you contracted?
We do.
Do you contract with other people?
No, we have our own service. Do you know off the top of your head? We have lots of ambulances and lots of people.
Not off the top of
I
my
don't.
head, there's a lot.
It's quite a large service. We run the 911 service also for the region. And I know this last year we just bought 3 new ambulances, so I think we have probably 6 or 7 now.
Easily.
Easily,
Not
so,
more,
yeah. And what we've done actually recently to increase our response times is we have partnered within the Helena community, and instead of keeping all our ambulances at the medical center in the facility there, we've actually farmed them out. And so we have them in different parts of the community, and it has increased response time, which has been very positive. And gotten a lot of great feedback from the county as an example about doing that. So.
And are your ambulances staffed by EMTs or paramedics?
Great question. We have lots of paramedics, and I don't know that, and EMTs. I'm not exactly sure the mix, but we have lots of both.
Okay. Anybody else have any questions? Okay. Anyone on the commission have any questions? Taylor? Thank you for your time.
Thank you. Much appreciated. And like I said, if you need anything, just holler. Feel free to just give us a call up there, or we're happy to come back and visit again as things continue to develop here in town. So thank you for your time.
Thank you.
Thank you. So we'll move on to our 11 o'clock. Cory Swanson, County Attorney, elected officials liability coverage for Section 290-305 MCA.
This is something that Judge McMahon asked us to do, right?
Do you want to read through that, or do you have it?
Yes. Want to read it?
Yeah, if you
Okay. From the Montana 1st Judicial District, Broadwater County. Come now, defendants, Board of County Commissioners of Broadwater County, and certify to the court that at all times during the actions and events which are the subject of the above captioned suit, the officers and employees of Broadwater County listed below acted within the scope and course of the development with Broadwater County. And this particular suit is between Joseph Smouse, Board of County Commissioners, Broadwater County Office of Broadwater County Attorney. And it lists the names of the commissioners: Laura Obert, Mike Belger, Darrell Folkford, Franklin Slifka, Cory Swanson. Pursuant to Montana Code 2-9-305, Section 5, the defendants acknowledge that Broadwater County is responsible for any wrongdoing by any of the said officers and former officers. In the event the tier of fact determines such an outcome, defendants assert the exceptions in 2-9-305, Section 6, do not apply in this case to the best of their knowledge. Defendants provide this certification without admission of negligence, wrongdoing, or liability in this case.
Is there any further discussion on this matter? Guess we will entertain a motion. Yes, Tim?
Just a quick question or a point here. I was trying to get up to speed what this was about on the agenda, and of course I'm going to say it's a typo, 2-90-305 instead of 2-9. I'm assuming that it's 2-9, 305, and you just mentioned, Mr. Fulford, 306?
There is a,
So,
yes.
just needing a little more clarification there if possible.
Both of them are listed in this.
Okay,
Yep.
thank you.
Yep.
Any further discussion? We will entertain a motion to sign
I'll move that we sign this acknowledgement.
I'll second the motion.
the motion been made and second to sign certification of Broadwater County responsibility to act without prejudice. Any further discussion? All in favor?
Aye.
Opposed, same. Motion carried.
Do you have an extra copy of that available, Mr. Chairman?
You can have mine, Tim.
Thank you, sir.
So let's see, at 11:15, Teresa Munson, Public Health Director, Bloodborne Pathology Policy. We're 10 minutes early.
And that's canceled. I sent an email. We had agreed at conference that we would do all that when Mike Myers was back next week. It's all part of safety. I didn't realize the bloodborne pathogens was in connection with the other, I think it was PPE that I had asked a question on. So that's a typo as well. Should be next week.
So do you want to go ahead with your Mako update?
Sure. Did you have more to add, Daryl? I didn't. Did you
No, I mean,
attend
you
a
know,
committee?
I mean, it's hard to recall all the different committees that we attended and things like that. And, I just want to say for me, I guess it was great information and a good opportunity to talk with other commissioners and understand that we're not all unique in the problems that we face. I mean, we all face the same problems, and it's nice to listen to how they met some of the challenges that they had, and hopefully we can use them here. That's really about it.
All right, yeah, I'll give my report then. I attended both Justice and Public Safety, which I chair, and then also I was asked to attend Health and Human Services, which is interesting because some of what we talked about, all our hospital people are gone, but we did talk about long-term care, and so I'll share some of that information as well. Justice and Public Safety, I did share this with you guys. I think you were there for the report. But we need to put together some long-term planning. There's some things coming up the pike that are going to be not nearly as dire as Colstrip 1 and 2, but also we need to know what's coming. We need to have a plan for when it hits and how it hits. So a lot with Justice and Public Safety specifically, and that's where I'm going to start. Here's some handouts for you guys. I don't know if you took any from the report given. And Brandon, I have a set here for you too. Whoops, I did not mean to do that. So if you guys have any questions, I'll just let you kind of review stuff again. I already gave a report on this. But just some highlights. The step up, which is in there, I do believe. That is this one. Nicole wrote a grant for Broadwater County for this, and this was when I asked the team from Gallatin County's detention center after their presentation, what about prevention, which is where you spend about 1/10 of the cost and get 10 times the benefit. And they directed me to the Stepping Up initiative. This has been used successfully around the country, also in other places in Montana. We did have the grant, it unfortunately got turned back, but that is an option, and it has had success in other smaller counties like ours. So if you guys have any questions, I suggest we pursue this again. But it has to be done in partnership. Crime Prevention Conference, I'll be sending out an agenda. If you guys are interested, we do need to have commissioners going. To understand what law enforcement does, we're the guys that fund it. We need to understand a lot more about law enforcement. So if you guys are free for those weekends, it's the 8th through the 9th of October. I highly recommend that we have commissioners attend as well as law enforcement. Wynn has gone in the past. And then this one, here's a couple of handouts for you. This is the Test It Out.
Oh, yeah,
So,
I actually tried it.
good, good. This was started by Joe Briggs. So, you know, when you ask why Montanans participate in the National Association of Counties, the expert for the nation on PILT is Todd Devlin, commissioner from Prairie County. Joe Briggs started the Test It app so that we can communicate with Congress. Mike McGinley from Beaverhead County is one of the most respected people on the Hill. When he speaks, our Congress people listen. So Montana's presence at NACO is incredibly important to the state. So the Test It, how this came about, some of your companies that provide fiber, broadband, high-speed internet, low-speed internet, are reporting to Congress that if they just find one person with service, regardless of the quality of service, they're reporting, yep, that area is covered. That's not accurate. We have two companies right now. Verizon has pulled out of an area here in Broadwater County and has left some people with literally no internet service. When you look at the fact that most of us are on cell phones, you can't get a landline anymore. You're talking about people's lives, not just the convenience of watching Netflix. We are talking about work, phone calls. We're talking about life and death. We had our Board of Crime Control retreat in Fort Benton. AT&T's pulled out of Fort Benton. You cannot get internet in Fort Benton if you have AT&T. So this is a really big deal. So if anybody is interested, what you do is you get the Test It app, put it on your cell phone, and then you can actually ping it wherever you are in the state, and it sends a message, compiles numbers for Congress so that they can get a more accurate idea of what places do and do not have internet or phone connectivity.
That's the thing I thought was interesting about this. You can be wherever you're at out in the community, and you can run this app, and it will log your location and send that information to a database, and it will tell what the internet speed is. And I did it for where I live, and it's obviously way below the national standard. So that's important for rural internet and what our future is.
So the biggest thing financially for counties from the justice side of things, and all your handouts talk to this, but it's Medicaid expansion. And I don't know if all our folks are on. I'm going to find the person at DPHHS and send that out to everybody. But if the people who are booked into our jails across the state have their Medicaid suspended and not terminated, we counties stand to save a lot of money, and that's the bottom line. A person who ends up going across the parking lot to the hospital for a heart attack or a ruptured appendix, if they're out for 24 hours and they have had their Medicaid terminated, that bill is on us. Now, we do have inmate medical, but we also have a $10,000 deductible. If that coverage is suspended, Medicaid will actually pay that bill.
Who makes that determination, by the way? That was a question I wanted to ask, and I didn't get a chance to during that.
Medicaid does. So if an inmate is booked and goes into jail and already has Medicaid coverage, they can have it suspended, and that, all you have to do is ask. It's
Okay.
not, if that's your question, who makes that decision,
Okay,
if it's
so we do
terminated
that
or
here
suspended?
In here,
Yes, thank you.
Yes.
Yeah, the individual jails and the individual counties make that decision. So a person who's coming to stay here from Carbon County, their sheriff, deputy, whoever decides that they're coming to jail at Broadwater County, they make that decision and call on behalf of their citizen. Broadwater County, who's booked here, whoever's booking or whoever's that point person in the sheriff's office makes that call.
okay.
Yeah,
For our residents.
right.
You're making that call, Brandon, is that
Well,
right?
I guess I'm a little confused on what we're really talking about here. I don't book people in and ask if they're on Medicaid, so I don't even know. I'd have to review what that process is and what we're discussing here, so. I know that we do, call out to Mako on some of the billing and things like that, on how to bill it, but I might have to talk with Tammy. She'd probably be the best person to know.
And not everybody will have it, and that's where that question comes in. If it is terminated, because the question isn't asked, and to clarify, you guys would not be responsible for Carbon County.
Right, just for our residents.
Right. If that question isn't asked and it's automatically terminated because we didn't ask, because we didn't put that part into our Medicaid expansion law. What happens is, again, that a ruptured appendix is on our dime, Broadwater County citizens' dime versus the feds. And two, when that person is released, this is all pre-sentencing, so innocent till proven guilty. When they're released, it takes another 9 months to get back on. Well, if they have a mental illness, that's 9 months without meds, chances are they're coming back. The cut in recidivism from doing this quick phone call, has been incredible. So you think about it on the front end, yeah, you're going to spend a little bit more time to make that phone call, get that suspended. On the back end, the idea is you're not going to see them again. Where's the cost, where's the time savings? By doing this at the front end. So, yeah, that's a big deal. It's not in our law that it's automatic, but it's in the federal law, so all we have to do is make a phone call. So, I'll get you the contact person at DPHHS, and, yeah, hopefully that'll help.
So is this basically saying that they also cover their medical expenses while they're in jail then, or is that, what do you?
No,
It just-
no, so
this
that's-
just makes it so it doesn't get suspended at the end, or they're
And-
still on it, basically.
right. If they're just suspended the day they're let out, they get it back, turned back on. That means they can automatically give 5 days of meds. That's fine if you're back on your health insurance. 5 days of meds is nothing if you've got 9 months to get reconnected. So, yeah, it's to get them the care they need once they get let out, and also if they have a major medical and they're in the hospital, then Medicaid will cover that instead of us. And that's where,
Fine with that.
yeah,
Yeah.
yeah, $10,000 per inmate, that's a lot of money. So, Health and Human Services. Bill asked this question, there wasn't an answer. I have the answer. I have it from Department of Health and Human Services at the state. There have been 13 nursing homes closed down in this state alone. There's several counties right now looking to get rid of their nursing homes because Medicaid, for those who do not have money, is paying about 2/3 of what it costs to take care of somebody in their last years who do not have money. And in order to get on Medicaid, you have to sell everything. Your house, your car, everything. The private in long-term care facilities, assisted living and such, or post-acute care, they can limit the number of Medicaid patients, Medicare patients they take in, so that it doesn't hurt the bottom line. So most of their people are private pay. Your county-owned or CAUSE, critical access hospitals, don't limit or can't limit. So that means that the bulk of the people who are being underpaid by the feds and the bulk of the people who do not have the means of paying by themselves are all going to one place. And those places are shutting down in the state at an alarming rate. So that's incredibly important in saying, well, you can use a private system, or they're opening these private places. They are, but they're not caring for the people who don't have means and who have the very serious dementia, Alzheimer's, that kind of thing. So it's a really big deal. There was a lot of talk about the IGT because there are so many of these nursing homes. IGT is intergovernmental transfer. We had it prior to you coming on board. And what that was is counties could take from PILT or general fund a certain amount of money, and we would give that to the state. They would match it about 40% and send it to the nursing homes. We did that with our nursing homes several years. I think going back to the 80s, and it was a long-term thing we were doing. And what that was meant to do is offset the loss that Medicare wasn't covering so that our nursing homes could continue to care for those people. With 13 of them closing down, there's a higher burden put on the ones that still exist. And a lot of counties, because there's been so many unfunded mandates, are saying, we don't have it. And so that's the other reason that we have 13 of them shut down. So it's very serious. What we're going to do about it, I don't know. What you just said about cold strip 1 and 2 makes me think the state's not going to step up. That's the other thing. Victim services, there's cuts coming. We've got to be ready. And drug task forces. We are the only, and Brandon, I don't know if you know this, but we are the only state in the union that has absolutely no general fund assistance partnership with local law enforcement for drug task forces. It's totally the grant from Board of Crime Control and local input. Absolutely nothing from the state. We're the only state in the union. Victims of Crime Act, that's what funds victim services upstairs. Also, we are the only state in the union that relies solely on Board of Crime Control and local governments. And with our state passing so much on to us, at some point, your turnip doesn't have any more blood in it. So, I think that's my equal dire negative report to Mike's. Yeah.
So if you had 13 post-acute cares that closed, how many were open? Even private, there was none opened in the state, or did anyone open an acute care facility?
No new acute care.
13 were closed.
Exactly. That's not to say assisted living. Several assisted livings have opened, but because they don't take the patients who need acute care and their patients are self-paying, it's a viable business model. But what's happening is we're creating this hole with no plan to fill it of just the people who can't do self-pay or people with dementia, Alzheimer's, long-term issues that need the help they cannot get from assisted living. So we have several people who are out here at Silver Springs that got to the point where they simply needed more care than they could get, and they're now living here, just across the parking lot, in our acute care facility. Some of them are still private pay, some of them are not, and as time goes by, that money runs out. But it's the extra care needed. A patient with Alzheimer's needs far more than somebody who just can't live in their home anymore. So yeah, that's the difference. None have opened. 13 are lost. Assisted living does not take care of those with additional needs or no money. So that was a depressing meeting. But I guess, when you talk about it, at least you put it out there so that we can start thinking about what to do about it. And if there's a group that'll think about and come up with a plan, it's county commissioners.
So as far as public safety is concerned, so do they have to ask these people when they book them in, are you on Medicaid?
I don't know that you would ask the inmate. I think the best thing to do would be to probably have email contact with whoever our contact is at DPHHS and shoot that to them. Just booked in Joe Smith, do they have Medicaid? That person would then respond yes or no. If it's yes, then our next would be please suspend as they're being booked into jail. If the answer is no, then you don't do anything more because they have either no insurance or private.
I think the issue with that is that I probably have to have like some sort of general email for detention. You're not going to have the same person. I know DPHS isn't going to respond at 3 in the morning or anything. So, and I'm not to say anything too bad, but they're busy up there, and sometimes it takes, quite a while to get an email back from people, so I guess I'd really have to work that out with them, a phone call, or how that was supposed to work.
And if you think about it, okay, even if you have to wait till Monday morning at 8 or wait a week for that answer, most of our people who are staying with you are not staying just one night. If they are, it's really not a big deal. What this really is the people who are staying for months waiting for their trial date. And during the time of booking and then trial date, which is an average of 180 days in the state, what can happen? If it's somebody who's only there for the weekend, you might not even want to bother. But if it's somebody that's going to be long-term, why the heck not bother?
Yeah.
Because you can save a lot of money.
I think we would nail it down to probably felony charges, make that email or call, and not many misdemeanors, because you're typically a night or less. So we can definitely look into it and work out.
Yeah. But I think from our discussion, it sounds like a lot of people did not know this was an option. And NACO did their homework. These things all come from the National Association and came back with, you do have this option, it's just not automatic. So that's the big push is when we learn information, sharing it so we can use it. I did get reappointed to the National Association of Counties Justice and Public Safety Committee, so we'll keep you guys in the national loop. As well, we meet via phone conference once a month, and then at the conferences. So I'll get you that contact as soon as I have it.
You shoot me an email?
Yeah,
Thank you.
absolutely. I'm going to send it to Sheriff Gutkin and have him send out it to all MSPOA too.
Okay.
So at 11:30, we're supposed to have the Recreation Board Holloway Park improvement project.
So the Recreation Board would like to pursue this project of including a single vault toilet down at Holloway Park. Back is a map of where they would like to place that. They have gone out and got a bid of what that would cost, $15,650 for the, and I think, company in Missoula. It's kind of one of the only ones around that can do it. They do not have excavation cost yet. They're still working on that. And they have met with the city and talked about if the city's okay with it first off, and then also what the agreement would be with the city to maintain that facility as far as for pumping it out. And I think that the city has agreed to do that. I think they have money to do that, but I'm not positive on that, so. Can I have that one back? Or I think I got notes on the back of that one in my report. Yeah, there we go.
So a question I have on this was brought to me about 2 weeks ago, maybe it was right before Mako. The law may not allow us to spend money from subdivisions on this. So the 80, you used to be on this board, I think. There used to be 86,000, it's give or take. Now I don't know what it is, but that money was from subdivisions that were platted, and they had two options. One, to dedicate a certain percentage of land to park property within the subdivision, or payment in lieu of parkland. And what they would do is convert that, whatever that is, to a monetary fee that they paid, and it went into the Parks and Rec Board. There's law in Title 76 that says that money must be spent on recreation, and it must be spent in the general vicinity of the subdivision. It doesn't have to be in the subdivision, but it has to be in the general vicinity. The question was, is the city of Townsend the general vicinity of a Broadwater County subdivision? We don't do subdivisions in Townsend. That is the city of Townsend, and they have their own regs and their own laws. So since this is not in the county, and Townsend is in the county, but since they have their own planning board, and this is not in the county exclusive of Townsend, can money be spent on this that is specifically come from subdivisions? The answer was no. The Parks and Rec Board does have money from the trust board after they pay Jerry Grabentz for the work he's doing. And there was the donation from the trust board from the money they got from Sharon Walker at JSJ. So is that enough to cover this? If it's not, what's the plan?
I think that it is. I think that was what their plan was to use the trust board money.
Okay.
Yeah.
And even with the excavation, that'll be enough?
I don't know that for sure. I don't
Okay.
think the excavation is going to be a whole lot of money, but I guess that's what they can talk about at their next meeting.
Okay. I did talk to Adam about this.
Okay.
So he is aware. We just need to make sure that this is an excellent project, but we have to make sure that we're within law on how we pay for it. And so I think it's a good project. I will vote to proceed, but want to make sure that that monetary part is covered. We don't want to get sideways with spending money inappropriately. So I guess with that said, I move that we support this project and the overall view moving forward.
Yeah, I'll second the motion.
I have a question. How are they gonna unload this thing?
Yeah, that was one of the questions of whether they need to get a crane to do that or not. But it's also possible that the outfit that delivers it has the ability to
Bring it on a crane?
Yeah.
Or with a crane?
with the, those trucks that have the cranes on them.
Oh,
You know what I'm
okay.
talking about?
Yeah.
I think we'd need that nailed down.
Mm-hmm.
The city, are they going to care for this nailed down? Because we don't have ongoing funds from the rec board, so it has to be the city.
Right.
What's the excavation cost, and can all this come in under the trust board money? I think those are the caveats that we have to have. And that, as moving forward, that doesn't mean this is approved. It means we're going to be getting the answers and an ongoing report of where this is at, and allow them to work with the sanitarian, contact the city, and get those answers. It's just the first step, approving the process to move forward with the proposal.
seeing this, they're gonna have to redo this quote because this quote is only good until materials ordered prior to 6/18/2019.
I think that they're going to work with them, from what I understand.
Yeah, Shirley, you have something?
I have a question. How many city parks are there, and is this just opening the can of worms? Are we going to then put one at Swimming Pool Park and all those other places? Are we just kind of opening the can of worms, or is this going to be the only one in town? That's discriminatory, probably, so maybe we ought to look down the road a little further and have a possible number of how many they might be requesting in the future for the city parks.
I think this is really the only city park that has a large amount of kids using it, does not have a bathroom.
Does the swimming pool park always have access to bathrooms?
Whenever the pool's open, it does, which would be, I mean, that's the only time. And it's the same thing with McCarthy Park. They only have that when the weather, I mean, they would probably be shutting that system down within the next 2 weeks. And then what they normally do is put porta potties in there for soccer if they continue beyond what they're, in fact, I think they put porta potties in there regardless.
Okay, just a question, you know, because if you open that can, sometimes there's more than one worm gets out.
And I'm not so sure that their long-term, I think that that's part of the rec plan is to address this also.
But that means more money down the road. That's what I'm looking at, is if we spend this on this park, then where does the money come from for the next park and the next park and the next park?
And I think the funding mechanism of the Canyon Ferry Trust is pretty much where
Okay.
most of those are going to come from.
Just a thought.
Not a bad thought. So is there any further discussion?
Ann, could you read what the motion is?
The motion's very simple. You move to support the project.
Thank you. I would like to amend my motion because I think it is too simple. I would like to amend my motion that we support beginning this project and would like solid numbers back for the excavation, crane, the total cost for the project updated, who's going to take care and maintain this facility. But through this motion, authorize the Recreation Board to work with Sanitary and the city and other partners as needed to gather that information for a final decision. How's that?
I guess my question would be, who owns it?
It's the cities is who would own it. This would be a gift. Because they're the ones that would be responsible for maintaining, upkeep. Yeah, I don't think there's another way to do it. Because of the precedent set of the county, then we don't have the maintenance staff. So that would have to be a question. It would be just like with any of the other facilities we have. We would treat Townsend as a recreation facility. Who owns what we put out at the silos? BOR. Who owns what we put at the Rod and Gun Club? Rod and Gun Club. Who owns what we put at the golf course? Golf course. I think it'd be the same thing. And so the city has to be okay with that.
So do we want to make the motion to, like you said, but then add on the end of it with to be gifted to the city of Townsend, and then we're out of it?
Yeah, I accept that friendly amendment, you bet. I think it's a good idea.
Okay.
Yes, I already added with city ownership of facility.
Perfect, aren't you brilliant?
just anticipating things.
Any further discussion then? Okay, so seeing none, all in favor?
Aye.
Aye, opposed, same, motion carries. Okay, so we go over to our 1145 County Annex approval of Bureau investment loan for purchase and renovations of the Opportunity Bank building, right?
Yes. Yep. So I don't have anything yet for us. Did get an email from Louise and then Savannah today, this morning. Louise last week, Savannah this morning. They are compiling the paperwork and want to sign on the 11th. They're going to cut us the check for $150,000 to start, and then the rest, as we use it, it's a reimbursement. And I think that's it. Everything's ready to go. It sounds like there is one piece of paper they do want from Cory. He needs to return that to them. Other than that, it sounds like it's just a matter of getting together to sign. So on the 11th, I asked Nicole to do our TED meeting fairly early or late in the afternoon, and then do this on the other end of the day, if that's good with you guys.
Days. That's a Monday?
Actually Friday.
Yeah.
It's a Friday,
Yeah, it's a Friday, okay.
If that works for you guys.
Yeah, it works for me.
Okay.
So, so do we take possession on the 11th then, and Mike can start working on that on the...
That's my hope. He has been trying to get a hold of Opportunity Bank, and they just have not connected. What I would like to do is let them know we're going to be signing papers on the 11th. They know this has been coming. Hopefully we can have a very quick turnaround.
Okay.
Yeah.
Because the last thing we heard from Earl Griffith and the Petroleum Board people is we didn't get any bids on the demolition of the ambulance building.
Right.
So that's probably not going to come down until spring.
Correct. Yeah. So it buys us a little time with the ambulances, but we don't want them in there because there's a broken window now. It's not secure. So the sooner we can move in, the better. I know Mike's chomping at the bit, Mary Mystic's chomping at the bit, so we've got a lot of people anxious to move forward.
We probably also need to send notification to the hospital so they can do something with their records.
Yes, and they've been
But it'll
working on
still
that.
it'll still be a secure facility even once we move the ambulance out of there, right?
It will be locked, but it looks like somebody's getting in, or at least trying to.
Okay.
So probably as soon as we can, they need
It's
to.
in the old building, right?
Mhm. Yeah. And I understand they're going to use an empty room for the record storage,
Okay.
so that'll be much more secure and weathered in what they have.
So do we need to agenda this for the 11th, or do we
Yeah.
have an agenda for the 11th?
Yeah.
Okay. And we also have the TED hearing that day, right?
Yep.
Okay. Okay, so I guess we can move on to 12 o'clock PILT allocation for updating computers and programs. So what do we have here, 20 computers?
Yeah, and I think out of those 20, I think some of them already been replaced. Fair got a new laptop. Mike has a new computer, Mike Conkey.
Sanitation.
Sanitation.
Didn't Doug get?
And then Doug got, I think they got 2 new computers.
Right.
Or 2 or 3.
I believe 2, but I'm not positive on that. I know there's 2, I'm not sure.
Yeah, I guess I have you and
No,
No?
mine,
Okay, you did,
mine is, it's, I think, one of the newer ones in the office, but it's not,
Okay.
not just
Okay.
replaced.
so then it's just the two then, so,
And then public health was
yes.
already taken care of. How many is that, one or two? That was two, right? Didn't public health get two new computers?
At least two, or at least one.
One, I believe. So that's, I think that's 5. So I think out of that 20, I think we only really would have to replace 15.
There were several replaced a couple years ago, computers, but the programs are old.
Right.
So we need to make sure we don't replace some of those. Mine's one of those.
Yeah, so I talked with Josh on that, and then
Oh, good.
we can make that decision. He said that since Windows 7 is out the end of this year, he says he's only had limited success in putting the new operating system on the older computers. He said,
Oh,
he says, like at least a third of them or more fail.
okay.
So, yeah, so that's kind of the reason why,
Oh, darn it.
yeah.
Okay, we have to have them, and we cannot do our jobs without
We
them.
do. I mean,
So,
we need to be invested in our technology.
yeah, I mean, we simply can't do
We're locked
anything
into that
without,
now, the way
yeah.
we do business.
right? It's the world. Wow, okay.
So that was, so, yeah, I mean, originally, we kind of thought that we were just gonna be able to get away with doing upgrades, right?
Right,
Be a lot less expensive, and so that was what he said.
all right. Good to know.
Yeah.
Okay.
So on the list here, the new server, it includes a new server. It's gonna be, needs to be installed here. And that will, the advantage of this new server is that our county attorney no longer needs to have their own server. This is a 2-core server, so it can separate. And there's a firewall in there, so Cory can be on his side, and the rest of the county can be on the other side, and it's still secure.
Nice.
So it eliminates $6,000 for an additional server.
Yeah, yeah, that adds up.
Yeah, yeah. Then, of course, the licenses that have to go with it. Everything needs to have a license, right?
Right?
And they have their setup and installation. And that's the total cost.
Their setup and installation is actually quite inexpensive.
Yeah.
I think we get a lot more hours than we pay for.
Mm-hmm. And it looks like they're giving us a pretty good price versus a list price. We're getting a pretty good discount.
Yeah. Okay. You want a motion yet?
Yes.
I move that we proceed with replacing our servers and PCs and programs as required to have working equipment past the end of the year.
Yeah, I mean, that's only a couple months away, right?
No way.
And
Yeah,
for them to get this done, I think we probably need to get going sooner than later.
I
So that
agree.
we don't get, you can see what would happen, right?
Yeah,
First of the year rolls around and several of our computers won't work. So, I will second that motion.
So the motion's been made, a second, to replace our servers and our personal computers. Is there any further discussion? All in favor?
I,
Opposed, same?
There's a question.
Yes.
Just a clarification, Mr. Chair, is the reason for going with the PILT on this current budget cycle separated from the amended process that was approved earlier under the budget amendments, adding in, I'm just trying to understand why there's a separation there.
The budget amendments for last year, this is for 2020.
Oh, I stand corrected, I thought the amendments were for this
No, they're
Current,
last year.
okay.
That's the final one last year.
Thank you.
Okay.
That makes sense. Thank you.
Any further discussion? All in favor?
Aye.
Aye.
Opposed, same. Motion carries.
This is one of those things, when you talk to other counties, some of them do use their tilt to balance their budgets. And then when something like this comes up, they're scrambling because there's nothing to pay for this. We inherited the idea of not using PILT to balance the budget, and so when this comes up, we have a bucket to pay for it, and that's huge.
Yeah, well, you know, this was unplanned for, and these folks don't have this money in their budget to replace this equipment, so I think this is a good use of it.
I do too, it's capital improvement, which is what PILT is for, and it's unforeseen, which is what PILT is for. So it's a good use of PILT.
So is there any further items to be brought before the commission?
Do you want to remind everybody about our Wednesday meeting?
Oh, yeah, we have a Wednesday meeting at 10:30.
I think at 9 is the working meeting to software,
Oh, what time is that?
at 9,
At 9?
yeah. and
That's
then-
for Civic View software,
Right, and then 10 o'clock is the
subdivision,
subdivisions.
the agenda items, yeah.
Agenda items.
Okay.
Did you guys get my email about the Civic Plus?
Yeah,
Okay, so it got posted?
yeah.
Perfect, good.
Okay.
All right.
Okay, so we will adjourn at 11:40.